In the previous video, I have explained about OPD flow. So in this video, I'll show you the inpatient flow. So this is the inpatient module. I'll start with creating a admission. First of all, I want you to see this configurations where in this room or bed, we'll configure the beds or rooms or beds based on the hospital and based on the rooms or beds they have in their hospital. We'll configure here. Coming to inpatient, I'll start with a new admission. Let's assume Ananya Rao Reddy Patlola is my patient. Since the patient is already there in my system, I'm just searching the patient. If the patient doesn't exist, they can come from patients. Clinical details, elective. I'll take admission type as elective and I'll take expected length of stay. I'll assume that this patient is gonna stay for 3 days in our hospital. And I'll assign Dr. Madhavi. I'll think this Dr. Madhavi is attending the patient Ananya. So here I'll get the wards drop down from inventory. We can configure what are the wards we have in our hospital, like we have ladies ward or else men's ward or else maternity ward, general ward, like so this I'm selecting general medical ward. Sharing and room types also we have sharing, semi-private, like that. So this start date, end date are, for example, I'm thinking this patient Ananya, I'm expecting she is going to stay from 7th to 14th. So based on the dates, number of days will be calculated. And when I select room number and bed number, based on the bed and room, the unit price will also be getting from the configurations, because based on that room and bed, we have configured the price also. If there is a discount, we can enter or else we can skip that. So this is my net amount. Then I'll click on save admission. When I click on the save admission, the admission will be saved and it will be reflecting in this advance payment. This advance payment is nothing but just like an advance deposit. Let's assume I'm depositing some 5,000 amount, and this advance deposit amount it has nothing to do with the items charge. We'll just deposit some amount and at the end of the discharge we'll settle it. This 5,000 and I'm clicking on create. Wait a second. So that was a network issue. Let's skip that. So this is a patient I booked up admission for. So in this admissions page, we'll have card for each and every patient. Like for example, in general medical ward, room 1, bed 3, it was allocated to Anandya Rao Reddy Patlola. The green color represents the patient is still in that room or in that bed. That bed is occupied. If the patient discharged, then we'll show it as then we'll show with red color. When I open this patient Ananya Rao Reddy Patlola, this means I'm opening the case details of the patient. This is the case details, IP number, ward bed, admitting doctor, everything will be there. It's like a generic information of what we have given in the create admission. The allocation, and this allocation, this is the bed assignment room or bed charges we have given at the time of create admission bed assignment. If the patient is shifted to another ward or another room, we can add that also. Like generic, you can enter room number, bed number, start date, end date, price, and we can shift her or him to another ward, and we can show it here. This diagnosis. In this diagnosis, we can just enter what are the diagnosis the patient has diagnosed with. Next, this is the care team who is the attending doctor of the patient. And the OT request. Here we can request for the OT. For example, if the patient needed an operation or some surgery, then we need to fix then we need to book particular point slot of time. We need to reserve that room. So for that, bring OT request. For example, see OT room 201. I'll take 1 hour, it may be schedule. So I'm scheduling this OT request for 7 now. Save and next. Laboratory. This laboratory, it's same like visits laboratory. We can either search by the lab test code, which we will configure in the configuration in price list, or else we can manually enter here. Then radiology, it's the same like laboratory. We can search by the code or search by description, or else we can manually add here. Procedures is a part of item. Like we have wound details or else any other procedures like operations or whatever it may be, can have them here. Supporting info, it means we can provide the vital signs or else any other history of present illness or past illness, physical examination, anything related to diagnosis can attach here. Attachments, medications, here the doctor can prescribe or give any medications that the patient needs. They can prescribe medications over here. They can search by medications or else the search. Like this we need to search and we can need to enter these details. See, for example, I'm searching for paracetamol. Medication codes, paracetamol strength, I'm giving like 500 mg quantity. I'm prescribing some 10 tablets. Net will be calculated oral. Here we are saying like through which route the patient need to consume this medicine. Like either it's oral or dosage timing. Here we need to say from which date to which date the patient need to continue this medicine. 2 times or 3 times daily, it will be frequency unit. Medication. Equipment usage. It's nothing but whatever the equipments used for the patient throughout this admission, like ventilator or portable ventilator, infusion, syringe pump, dialysis machine, anything. We can add them and we can charge for them also. vaccination, if patient or any him or her, if any vaccine is provided or if any vaccine is given, we'll add them here also. For example, for this patient, I have given some influenza vaccine. For example, I have given dose 1 and whatever the date given, I have given on date 7. I'll also write what is the next dose. For example, I have given influenza vaccine dose 1 today. Then I'll write next due date also. Like for example, I'm giving 22, quantity 1, unit price, whatever the price you have for this vaccine. Whatever the prices we have in this section, we can configure them in the configuration. It's like a one-time task. This doctor visit, nurse notes, and drug administration. They are like they can enter some notes. For example, Ananya Rao Reddy Patlola is my patient, and I'm a doctor. If I'm attending her, for example, in today only I have visited her 2 times. Then I can write notes. Morning, what is the situation